सो हेलो गाइस, मेरा नाम है सुब्रत एंड आई एम ए सेकेंड ईयर MBBS स्टूडेंट एट GMC सुंदरगढ़। तो आज हम कंटिन्यू करेंगे हमारे सेकेंड ईयर के हिस्टोपैथोलॉजी सीरीज़ को, जिसमें कि आज का जो हमारा वीडियो होने वाला है दैट इज़ ऑन कैपिलरी हेमांजियोमा। सो लेट्स स्टार्ट द वीडियो। सो व्हाट इज कैपिलरी हेमांजियोमा? It is a benign vascular tumor of small proliferating capillary-sized blood vessels. It is especially seen in infants and children of small age group. Now you can see this is capillary hemangioma. Now the etiology. The exact cause is unknown, but it is related to increase in vascular growth factor activity and increased angiogenesis may lead to the capillary hemangioma. The most common sites are skin, lips, tongue, oral cavity, face and scalp. Now the gross and clinical features. It is well circumscribed, elevated or nodular, bright red swelling. You can see it is well circumscribed. This is well circumscribed. This is bright red and nodular. Soft and compressible, blenches on pressure. It is painless and may bleed after trauma. So now let's go to the histopathology. So before going to the histopathology, first how can we identify that this is the slide of capillary hemangioma? So to identify the slide, first take the slide and focus the slide on scanner or low power view. Then go to the margin end, and in the margin you can find that this is the epidermis and this is the dermis, and you can find the keratinized squamous epithelium, and the dermal appendages. These are the dermal appendages. These are the hair follicles. And these are the sebaceous glands. These are the dermal appendages. This is a hair follicle and this is a sebaceous gland. So by finding these dermal appendages and keratinized squamous epithelium, you can say that the mother tissue is of skin. And after confirming the mother tissue, you have to see the small thin-walled capillaries lined by discontinuous endothelium and presence of RBC in the lumen. So then you can identify that the slide is of capillary hemangioma. Now let's see the histopathological features. There is numerous small thin-walled capillaries, thin connective tissue stroma. You can see these are the thin-walled capillaries. Lined by endothelium or discontinuous endothelium and thin stroma. There is absence of inflammatory cells and fibroblast proliferation, means there is no inflammatory cell infiltration and fibroblast proliferation. The lumen contains RBC. This is the small capillary. These are the small capillaries and their lumen is filled with RBC. And there is presence of ulceration and bleeding. So these are the histopathological features. Now let's see some differential diagnosis. The differential diagnosis among capillary hemangioma, granulation tissue and pyogenic granuloma. The margin of capillary hemangioma and pyogenic granuloma is well circumscribed or well defined. But of granulation tissue it is diffuse type, and the architecture of capillary hemangioma is lobulated, and of granulation tissue it is non-lobulated, or there is no lobulation present in granulation tissue, and of pyogenic granuloma it is lobular. The inflammatory cells are absent in capillary hemangioma and present in granulation tissue, and there is a lot of inflammatory cells infiltration in pyogenic granuloma. Or the fibroblast proliferation that is absent in capillary hemangioma, that is present in granulation tissue and present in pyogenic granuloma. And there is edematous stroma that is present in pyogenic granuloma. So this much for today's video. Thank you.